Okay, so I'm going to go through the motions for each item that you're going to be potentially using. First of all, you're going to patient identification. That is the first thing. And the 4 identifiers we use are name, date of birth, medical record number, and visit number. You do not ever go by room number, and you do not ever go by bed number. So when you first approach the patient, what's the first thing you're going to do is hand washing and or foam in, foam out. Sanitizer is your friend. Okay, so you sanitize, you got your gloves on, and of course there's motorcycles. So you're going to put a tourniquet on. You always go above where you're going to go, where you're going to poke. So you're going to tie the tourniquet. Oops. Tie the tourniquet. There you go. You're going to find a vein, because you can't very well find a vein if it doesn't plump up with a tourniquet on. Then you're going to clean it. And then you're going to get your stuff, your needle, pull back your safety, uncap it, check it for burrs, and believe me when I say there are little tiny fish hooks that do sometimes come on the end. You're going to hold it here, anchor your vein. You can do it this way or you can do it this way. Some institutions only like this way, because if you do it this way there is a potential for sticking yourself. But you're going to go in 15 to 30 degree angle and you're going to hold it. Then you're going to draw your blood. There is water coming in through here. It is not colored, but it is there. Take it out. Your next tube is going to be green. Put it in. Wings are your friend. Your next tube is going to be purple. Put it in. Wings are your friend. Then your next tube, you're going to take the tourniquet off. You can draw two green lavenders while you're waiting for the time frame to go. Hope you can see this. And you're going to take it out. And then you can draw your gray. Gray, remember, is no tourniquet, and it needs to be on ice. So withdraw. You get your gauze. Place it over this. No pressure, no pressure, no pressure. Pressure. Safety. And then you're going to discard it in the sharps. Then you're going to tape it with some tape. Don't be afraid to use the gauze, because that will hold additional pressure. You're going to gather up all your materials. You're going to mix your tubes. All tubes, regardless of additive, will be mixed 8 to 10 times, nice and gently. 8 to 10 times, okay? Check the bandage, make sure there's no bleeding. Make sure your bed rail's up, all the lights are in the reach of the patient, and the bed is down at its lowest position. You can ask if there's anything else you can do, or if you can pass on along a message to get his nurse or what have you. But that right there is your vacutainer draw. It's called a vacutainer draw. Now I'm going to show you how to do a syringe draw. You're going to get your syringe, which is right here, and you're going to make sure you get your transfer device, which is right here, and you're going to go through the same steps. You're going to tie the tourniquet on. You're going to clean it, concentric circles. You're not going to blow on it to dry or fan it to dry, because that just gives it more germs. Get your tape ready. There's your syringe. You're going to pull back on the safety. Check it for imperfections. Undo the plunger so that it doesn't stick. And you're going to poke. And you're going to pull back on the plunger nice and slow. Can you see that? Nice and slow. Go any faster, the blood will hemolyze. Undo your tourniquet. Get your gauze. No pressure, no pressure, no pressure. Pressure. Safety. Tape. Now you're going to undo this needle off of the tube. You're going to put it on your transfer device, and you're going to put your tube in, and you can see where it's filling. The vacuum in the tube does all the work for you. And you can see here on the blue top tube that it is up to where it needs to be. So you want to get a blue and a green, and it pulls it in by itself. And then this whole thing goes into the sharps. You do not reuse this, and you do not reuse this. Then you mix your tubes, you label them, date, time, and initials, and then you bring them to the lab. Alright, now that's a syringe draw. Now with a butterfly draw, you have two ways of doing it. You can butterfly draw with a jacket, similar to a vacutainer, but you're going to check your ID again, wash your hands, place your tourniquet, wash it with, we do aseptic techniques. We do not do sterile techniques, only with the blood cultures. So you're going to wash the vein. Now you're going to take, obviously you're going to have gloves on during all of this, but you're going to take the safety off. You're going to look at it, and you're going to poke. Now the wings are big enough to where you can leave them hold, but then you're going to use your serum tube, and you're going to put it in your jacket, and you can see where the blood is filling up. Now that also eliminates the air, so that if you needed a blue top tube, you wouldn't have to worry about losing the air, because you have your airs gone right here. And then of course your green top tube and your lavender top tube. Take your tourniquet off. Get your gauze. Now with these butterflies, there's a little notch on them, and if you listen closely you can hear it click because it pulls back directly from the arm into the safety. So you hear it, and it goes right into the safety. Meanwhile you're holding pressure, and this whole unit gets discarded. Mix your tubes, bandage, and that is how that is done. Now the butterflies can also be used with a syringe. Syringe method with butterfly pretty much allows you to pull at your own speed. If the veins are small or weak or doesn't hold up to the vacuum that the tubes require, you can take this piece off and you can attach a syringe to it. Okay, so now you still have a butterfly with a syringe. Again, you're going to ID the patient, name, date of birth, tourniquet, clean it, undo the plunger so it's not so sticky, take the lid off, inspect for imperfections, anchor, and poke. Now this way here, you can see the blood or water, in this case I drained all the blood out, filling up the tube at your speed rather than the speed of the vacuum of the tube. So you can pull gently so as not to hemolyze. Okay. Undo the tourniquet. Gauze. Listen for the click. Hold pressure, hold pressure. Oh, see, there is a little bit of pink in there. Undo this. Use your transfer device. And then you can use... Now when you're doing this and you're using a blue top tube, you're not going to want to do it like this, because you're going to see the air in there. You see the air in there, and if you do it like this, where is that air going to go? It's going to go in this blue top tube, and it will not meet its volume. So you always want to make sure that your tubes or your syringe, when using a vacutainer, is flipped upright, so there is no air going into the tubes. Okay, and then all of this gets discarded. All of this aseptic technique, that was aseptic technique. Now if we wanted to do blood cultures, that is a sterile technique. You would want to use your ChloraPrep, which is this. Squeeze and let the medicine flow. You would want to scrub for at least 15 to 30 seconds. No, 30 to 45 seconds, I'm sorry. You go like this, you go like this. What I do to make sure that it is definitely clean is I take this first one and I discard it. So now I have a second one that I use, and I start from the center and I work my way out. Okay? Now your blood cultures, you'll see that they have little caps on them. You're just going to pop those caps off, and you're going to want to I always like to use a butterfly, but you can use whatever you want to use. Take the needle off, the cap off. Now you don't want to reinfect the site with your finger, so you're going to hold it and you're going to poke. Now remember I said aerobic needs to go first because you're going to have air in the line. So you're going to, and you can see the air, the water or the blood is going inside the tube. You see the bubbles. And you want to put at least, count to 30, 1, 1,000, 2, 1,000, or you can watch the lines on the side go up at least 2 to 1.5 to 2. So there's that one, and then you can use your anaerobic, I'm sorry. Now after your blood cultures are done, you're more than able to do whatever color tubes you need to have done. And you release your tourniquet. Undo your tube. Now this particular butterfly does not have a safety on it, but you would take it out, no pressure, and you would hold the tubing and you would lift the plastic to safety the needle. And then of course you would tape it. Now there are many different variables to many different tubes. That, my friends, I will do another video on. I will go over the hot topics, chapters 1, 2, 3, 4, I think 7 is your first one, and I will get those out to you. I will try to do it today so that you can at least look at it, what it is I'm talking about, for your test on Monday. I will get with you and invite you to my house. I don't know when, so that you can see these things. I will do it probably within a week or so. I can only have like 4 or 5 of you here at a time. We only currently have 17 students, so we are only going to be in my garage, but I will have you over so that you can see, ask questions, get to meet me, and see what it is that we do. I look forward to meeting with you. I hope this was helpful. It should be helpful at least for your quiz and or your first exam. I will try to do the hot topics with you on the next video. So good luck to you, and I will talk to you in a bit. Bye.